I have had people try to shame me before when I say that I am in recovery, and they personally know me, and they'll be like, "You still smoke?" Yeah, I do still smoke, but that's a far cry from where I came from. Abstinence-based recovery is not the only path, first of all. The 12-step abstinence-based path is actually the least effective. That's one of the reasons that rehabs use it, because they want to keep a revolving door of patients. A patient cured is a customer lost. They don't really care about you and your family. That's why they're telling you to practice tough love, which does nothing but harm. You can enable, which is a word that has been weaponized, in a positive or a negative manner. To enable is to help give someone the ability to do something. You can enable someone to get deeper into substance use, or you can empower and enable them to get better. And a lot of times that involves listening. What we need to stop doing is going around and telling them that they're less than human and that they're not worthy of a shower because they've used a substance. And we also need to comprehend that recovery is building a life you don't need to escape. Recovery has to do with building healthy coping skills, dealing with the trauma that caused you to make the choice to use in the first place. The substance is actually kind of irrelevant. There are many things that people struggle with that are not substance related. What makes it substance use disorder is the inability to stop despite negative consequence. You have to have the chaotic behaviors. So like if someone is on medically assisted treatment and they take their daily dose and they live a normal life, that is not addiction. That is not exhibiting a use disorder. That is physical dependence. And it's no different than if you cold turkey an antidepressant or, it's not recommended. The lack of education surrounding substance use disorder is intentional and it's harmful. If you only knew how hard it is to recover, and then pile on top of that everybody treating you like garbage, like you don't deserve to eat, like you don't, deserve anything. Bear in mind that just 6 months ago, when they didn't know that you were struggling with anything, you were up on a pedestal. But when my neighbor tried to shame me the other day, saying that I wasn't in recovery because I still smoke, I looked her dead in her face and told her she needed to focus on getting her alcohol use disorder under control before she started throwing shade anywhere else. I mean, dang. A lot of people don't make it out of what I have, and I have every right to be proud of it. And if you're in recovery, you have every right to be proud of it. And it doesn't have to be 100% abstinence. If you've never been there, just be careful what words you're putting out into the universe, because substance use disorder does not discriminate. It knows no socioeconomic bounds. Have a good day.